Hi, everyone. It's Natalie. I hope your summer has been as relaxing and fun as mine, and maybe even more so. Today, I have a special guest who's dedicated to empowering women and revolutionizing their health journey. Joining me is Dr. Stephanie Young Moss, a passionate pharmacist with a wealth of knowledge on women's health and an advocate for embracing life beyond menopause. Dr. Stephanie received her Doctor of Pharmacy degree from Xavier University of Louisiana College of Pharmacy and a Master's of Health Services Administration with a concentration in health economics from the University of Wyoming. She's not a traditional pharmacist, though. For 20 years, she's been focused on managed care, health economics, and outcomes research, and also health equity. Menopause, that's a word that often evokes apprehension and uncertainty. But Dr. Stephanie is here to challenge those perceptions. We're going to delve into the transformative power of menopause and the beginning stages called perimenopause. And if you're like me for many years, maybe you've been thinking, that's not me. I'm so young. But think again, because perimenopause can actually start in your 30s. Would you know if those symptoms started? I'd love for you to just take a minute to check out my website. It's natalietysdal.com. And if you hear anything that you want more information on in this podcast, be sure to go to the show notes for links. Let's get started today with Dr. Stephanie. Dr. Stephanie, I know you're a pharmacist, you're passionate about health and especially about helping women. So let's get right into that dreaded word, menopause.
Well, I don't want people to feel as though it can be a dread or a drag. And that's really part of my mission, is to let women know that life does not end with their period and that you still can live a colorful, wonderful life after that. So that's one of my main things, is because we have been taught, right, that it's dreadful. And don't get me wrong, some of the symptoms can be, pretty bad for some people. But I just want to make sure people are able to know that it's also a great thing because you're still alive too, right? So
Well,
you made it to menopause.
You know what? Glass half full here, okay?
Exactly.
Because you made it to menopause. And obviously we don't have to deal with the periods any longer once we get there. So that's a bonus if we're looking at the glass half full. But I think for a lot of women, it's everything leading up to it and the unknown. Mm-hmm, so,
right.
Maybe the periods get less frequent, or for some people, it's weight gain or hot flashes. But let's kind of draw back, because if women are like me, you're like, that's a long way down the road. It's going to happen so far. And then as these little things start to happen, like the weight gain or the energy loss, you don't always know that's what's happening in your life. And that's why you feel so crummy.
Right. And what I like to call it is waiting, like we're waiting for the hot flash to occur. But typically that's not some of the first things that you'll see, because that's all that we see is a woman fanning herself because she's hot, right? And that's all you hear about, someone sweating. But typically, a lot of times, I read in a study that what you usually see first are some of the mental signs, like you may have anxiety or depression that may increase, especially if you have a history of it. But even if you don't, some people can have new onset as well. So it's important to look at all the signs. For me, I believe it was some of the mental things, but then it was also like heart palpitations. And I never would have thought that that was a sign or a symptom of perimenopause, rather. Well, and just for, the record, in case someone doesn't know, perimenopause just means around menopause. So it's that period before you are into menopause. And menopause is when you have not had a cycle for at least 12 months and 1 day. So perimenopause is that time before, when you start getting all the symptoms, when your cycle starts acting differently. And it can last anywhere from 4 to 10 years.
4 to 10 years. So that's we often hear menopause and we don't even stop to then talk about or think about the peri is where the real stuff happens, where your life is changing and you have to adapt to it. So give us an idea of, people are waiting, as we know, longer and longer to settle down and then think about having kids. So give us the age range that typically people would hit perimenopause, and what's the youngest that we find?
Okay. Well, for the average, well, I won't say average age, but perimenopause can start anywhere from mid to late 30s all the way up into 50. So everyone's different. Some people may start seeing signs and symptoms in their late 30s, and then some may not even have that first sign of symptom until they're 50 years old. So it's just kind of a big range. And that's why it's really important to look at the signs and symptoms and to know your body and kind of see what's happening and if anything is changing. So that's the biggest thing is that it can start then. So you got to think about it. Some people, I think my last child, I believe I was 36. I think I was, could have been 37. But that was mine. But people start to have signs and symptoms then. Now it does not mean that you can't get pregnant. So a lot of people think, well, my cycle is sporadic. I haven't had it in a couple of months. Well, you may not have it for 9 months if you're not careful.
Perimenopause does not mean no pregnancy.
Exactly.
Right.
Because if you're still having a cycle, then you're still releasing
You're
eggs,
still ovulating.
which means you
Yeah.
can still, right, you means you still can get pregnant. So people need to be, aware of that. Just because you're having signs and symptoms, you still can possibly get pregnant. But
So
yeah.
for someone who say they hit 40 and they're like, now I'm ready to have a baby. Okay, well, you might start having these perimenopause symptoms, but you do get pregnant. Then you could find yourself with a toddler in menopause. And talk about two difficult times of life.
Exactly.
So let's talk a little bit more about handling the symptoms. So, and finding out where you are. Not all doctors, but some might say, let's test and see. What would you be
Sure.
testing for? And what might that look like? If you feel like I'm not myself, maybe this is what I'm going through. What would you suggest women do and talk to their doctor about?
Well, I would say at first, talk to your OBGYN if you can. And sometimes, to be honest, they don't always have the answers. You have to think about it. They are delivering babies, which is already a very hard and intensive task that you need to make sure that you're up to date on everything new with that, correct? And all the signs and symptoms and things that could happen with delivery of babies and taking care of when you're pregnant. So they may not be experts in menopause. So it's really up to you to find that person who is, it could be a nurse, it could be a pharmacist, it could be a doctor who specializes in that type of medicine. For instance, my doctor, she was an OBGYN. She delivered both of my kids. However, recently she has changed. She doesn't deliver babies anymore. She's gone into more of the aging, I guess, population and menopausal women because her population has gone that way. Everyone's had babies now, and so
She's
now
moved
they're
with their
moving into
clients.
it.
Yeah.
Yeah, exactly. And I think that's really smart to do because now we're coming to her like, I'm hot, I'm having heart palpitations, and I don't know what to do. So so she has to learn about that. But so it's just important to ask questions. If they can't give you the answer, or they don't know, or if they don't want to take the time to learn, then it may be time to ask around it for new recommendations or a second opinion, or rather, would be very important.
I love it that you say that because as a reporter and for many years of my news career, I covered health news and I always would stop and think. And now in this second stage of my life, I tell people like, if you don't feel like you're getting the answers, don't stop and stay with that same, or don't stay with that same person. Get the
Exactly.
answers.
Exactly.
I see an integrative health specialist and a doctor now where they look at natural things. They look at the drugs, but my general care integrative doctor does tests
Yep.
to
Yep.
blood tests to see all these different things. And they've been able to tell me you're not quite there. You're still here, but things are changing.
Yep.
And it's so good to have that information. Knowledge is power, right?
It
When
is.
we actually know.
And that I'm glad you mentioned that because you did ask me about what can you do. So you can do testing, or you can just look at your signs and symptoms too. So most people can be diagnosed just by the signs and symptoms, and there are so many. Some people may just have a hot flash. Some people may have hot flashes and night sweats, and then some people have the gambit of things where they have hot flashes, night sweats, anxiety, OCD. They may have itchy, dry skin. Their hair may be getting thin. I mean, it's a bunch of different things. So everyone's different, and typically, actually, I have a checklist on my website that's free that can kind of help you go through some of those signs and symptoms. You can check them off and take that information with you to your healthcare provider to kind of talk to them about it. But usually they can diagnose you by the signs and symptoms. And especially if your cycle is acting wacky or weird. So it could be short. It could be a lot heavier. It could be skipping. It could be getting closer together. So is any cycle changes is typically when your hormones are doing a little bit different thing. However, you can get a hormone panel done where they look at your different, if it's your estrogen, your testosterone, and your progesterone. They look at all those things to see kind of where you are. The issue with that is that your hormones fluctuate during perimenopause. So 1 week you may go and they're high. The next week you may go, they may be lower. So that's why some people say that it's just not necessary to get panel testing. And I will say I did, I got testing for myself. So, I wanted to know, but a lot of times they can just tell by your signs and symptoms too.
So what can someone do if they think they are in perimenopause, the beginning stages, they feel like crap. They're, again, like one of the first things you hear women complain about is I'm gaining weight and I'm not doing anything different. I'm working out and I can't drop those frustrating things. Is there anything they can do on their own in these beginning stages to try to just feel better? Are there some vitamins they can take? You're the pharmacist, so work out more. Like that's the frustrating thing for me. Yeah. It's like I'm doing everything the same, but things are changing, and working out's really not making a difference. And so you just want to do something.
You do, but the thing is, we can't do everything the same. So it may be because it doesn't work like it used to. Our bodies don't work like they used to. We don't digest foods the same way that we used to. There may be certain foods that you may need to adjust or add, take out or add into your diet, right? So you need to really think about that as well. So for me personally, and I will talk about vitamins as well that I personally take. But there are some things that you can do as far as naturally with your food, whether it's adding in foods that are high, that are phytoestrogen, which means they are higher in, they act like estrogen in the body, which are your soy, your flaxseed, your edamame, sesame seed as well. So those types of things are actually phytoestrogens, and they act like estrogen in the body. But of course, I always say everyone's health history is different, so make sure you talk to your healthcare provider before you add any of these things as well. So you can do those types of things, or you may want to change the type of exercising that you're doing or how frequently you do it. I'm not saying that you need to exercise all day, but you just need to realize, okay, I'm doing, are you doing things like strength training? Right. I think strength training and building your muscle is always important because that helps as well. And then what types of food what foods are affecting you differently? So keep a food journal and food diary and see, like, for instance, things like spicy foods, caffeine, and sugars, they all will increase. They can increase your hot flashes. So, and alcohol. So all the great things, hot food, alcohol, sugar, all of those things, they actually will increase it. So you need to just, I'm not saying don't eat them or don't drink them, but you need to be mindful that, okay, I had a glass of wine or two tonight. I just need to be prepared that I could possibly have a night sweat tonight. So they increase night sweats and hot flashes. So you just need to be kind of aware of that. And that will actually just help you be mindful of what you're doing, right? Yeah. Besides that, I think that, some important vitamins that I actually take, of course, I take, iron and a multivitamin that just helps with overall health and wellness for me. And I just do iron because when I was, my cycle was so heavy when I first started with perimenopause that really, people don't understand the importance of iron and how important it is for your heart health and your hair, your skin, like all those things is really important for your red blood cells, right? So that's important to me. And then also, vitamin D, which is important for your mental health too. Magnesium, which has various causes, which can help you with sleep. It can also help with your muscles and things of that nature. And also your digestive system, it can help with that as well. Vitamin E is always good to have, an antioxidant, of course. And then also omega-3 oils. Those are really good too when it comes to lubing up the body inside and out, because of course we know some of those things you dry out everywhere, when you're in perimenopause and menopause. So that really helps to lubricate with your joints and everything else. Yeah. It's so important. Then also with your heart health too. So those are just some of the basic ones that I would, mention when it comes to
just a few little things. You just mentioned it. If you can't remember all those things, we'll have some things in the show notes that will help, because that just a love you because what I'm thinking as a busy mom with, two jobs, I got the podcast, I'm teaching now, I got kids in different parts of the country. Like the hard thing is that this hits often when we're at our busiest. I
Oh
mean,
yeah,
doesn't it
yeah.
always when it rains, it pours? When we're at our
Yep.
busiest, we are chasing kids and we are, we're not slowing down and yet our bodies are slowing down and we
Yep,
don't
it's
know
true.
why. Man, I had what I think was a panic attack. I've never experienced that before. And it's
Yeah.
anxiety. My heart's racing. And we start as women, we blame ourselves and we go, what's wrong with me? Why am I doing this? When you have to give yourself a break. Like this is your body
Yeah.
and your body needs support, all those
You're
things you
right.
just mentioned. And if we don't put those things first, we're going to have a hard time dealing with the kids across the country and the job and all of those things.
That's
But
true.
it is
And
when
that's why
we
it's
are our
important to put
busiest.
yourself first too, right? I mean, I know, of course, we want to take care of our kids and they're going to be, priority. And we're always making sure that they're always taken care of. We know their shot records. We know what they've taken, what they've done, what sport activity is coming up next month. We know all of that, but we don't take care of our health first, and we don't take care of our own health and recognize things that are different. Then we really can't take care of them. So, some people may say, well, my kids are a priority. Yeah, but if you're not taking care of your health is not a priority, then you can't take care of your kids' health. So
Yeah.
you need to make sure that you're also taking care of your own
Yeah.
health as well.
And I like to say, I'm really glad that you mentioned that what example are you setting for your kids when they are older if you're not doing those things for yourself? We're only teaching our kids to take care of everybody else and not ourselves, not to be
Exactly.
selfish, but if okay, I'm going to say this because I need to do it myself. If you know your kid's sports schedule, like you just said, you should know what's going on in your body. You
Exactly.
should know, you
Exactly.
should know where your levels are. You should know and stop and say, wait a minute, I know everybody else's schedule, but I don't even know what's going on in my body. Like compare
Exactly.
those two things and be sure you're doing both equally.
Exactly. Like even when you're taking them to get their physicals or their sports physicals or their annual, if they have vaccinations or whatever, we have their schedule on our phone written out. And even today, for example, for myself, I'm going on a trip. I need a certain vaccine. I don't have my shot record because I grew up in a whole nother state. And I was
Mm-hmm.
like, I don't know if I've had, this shot. Let me check in. How can I check and see? So like, well, we can give you a titer test to see if you've had this, before. But like, we need to be able to keep up with our own vaccines too. What have you taken? What are you up for? What, not just your vaccines, but also your annuals. Are you going to the
Yeah.
doctor when you're supposed to and getting your checkups? And so
Yeah.
speaking of vaccines, there is the CDC, they have certain vaccines that they recommend for people of a certain age. And so they just put the hepatitis B vaccine on the list. So if you are between the ages of 19 and 59, they recommend that you actually get a new hepatitis B vaccine because it
Tell
was
me about that.
required.
Tell me why and what we would face if we got hepatitis B, why we need that.
Okay.
That's not something that I grew up thinking or knowing, or even that my doctor here in Colorado has told me I need.
Right. So with hepatitis B, it is a viral infection that attacks the liver. And there's about 2.5 million people in the United States that actually has it. And it's not curable. It's only preventable by getting the vaccine. And so CDC has recommended that if you're between the ages of 19 and 59, that you get this. And the reason being is because all of our kids already have it. Because the rule was set in 1991 that when you're born, you have to get it when you're born. But anyone before that, it was not required for you to get it.
So
So
it's
you
on the
may not
list that
have
our
it.
kids would have to go to school, college, all
Yes,
of that. But you
exactly.
and I fall into the generation where we didn't need that when we were young. Hmm.
Yes, exactly. You didn't need it if you're young, or if you did get it, it may be time for you to get it again. Exactly.
Mm.
During that time as well. So,
Yeah.
but typically, if you've had an update on your hepatitis B vaccine, you would know it. But most of us either have not had it or we had it when we were very, very, very young.
How
Very
is
young.
it contracted?
It's contracted through bodily fluids, typically through bodily fluids. So it's just important to be able to just protect yourself, right? When it
Yeah.
comes to hepatitis B in general. So, people say, well, I protect myself or your kids, they have the vaccine too, right? So if it's important for them to have that vaccine at that age, it's important for us to as well. So
Yeah.
anyone born before 1991 may be being unprotected from
Okay.
hepatitis
Good.
B. So it's
Really
important
good.
to have.
Good
And I think
information.
Thank you. And I think another very important thing to remember is that it is 100 times more infectious than HIV. So a lot of people,
Wow.
we hear about HIV all the time, but we don't really
Hmm.
talk about hepatitis B. And
Yeah.
why? Because it could cause you to have a liver transplant, you may have liver failure. All of those things could possibly happen if you're not, if you do contract it, if you weren't protected from it. So it's really important to have.
Well, good reminder
But
overall on vaccines, as
yeah,
you
thank
mentioned, and
you.
the bigger picture of find out what you've had, find out what you need,
And
see your
take care of
doctor.
yourself.
But let's talk. We talked about perimenopause. So once you go through the couple of years of that, that's the really yucky. Do things like start then to level out? Do you get then to that next stage? You're like, okay, the hot flash has stopped, and now I just don't have a period, or, or does
Well,
it
some
continue
people
forever?
do. Some people do, but the thing is, some people have it. Some people will level out, but then I know people who are 70s and 80s who still have hot flashes. So everyone is different.
Mm,
Some people may decide, to supplement with hormone replacement therapy, and some people may not. But it's just like when your body gets used to a certain thing, like you're used to a certain temperature or used to being a certain way, it can level out, but you don't really know how long it's going to take or when it's going to be.
man.
But people fail to realize that estrogen is actually protective for your body. So there are people who may have had hysterectomies, in their 30s and 40s, and they didn't get on estrogen. Estrogen actually protects you because it's cardioprotective. It protects you from diseases like obesity and heart disease because the receptors are all over the body. So that's why
Yeah.
you see so many different side effects, or side effects, not side effects, but symptoms of
Hmm.
perimenopause when your estrogen starts to go down because they're all over the body and people don't really realize that.
So I know there are different forms, and I think for people who think like I did for so long, this is when you get old, I'm not going to have to deal with this. But
Right.
are there different ways we can deal with this? Like I hear people talk about the pellets that they have put under their arm, or the pills, the natural versus the not natural. Like what's most popular, and where would you tell people to start?
Well, I think for most people, to be honest, what's most popular for most people is not to do anything because people are so afraid to take hormone replacement therapies.
Mm.
But I think it's up to the individual to decide what's best for them because there were so many studies in the day that did not, first of all, they were using synthetic hormones. They were using
Hmm.
older adults who were probably over the age of 60, I believe, or 65. So that's when they started them. So it's typically good to have it like after within the first 10 years after your cycle has ended. That's optimal age. But there actually now have hormones that actually look and act just like the hormones that are in your body. And those they're cheaper. You can get the prescription from your doctor. You can get those as well. So that is one way to look at it. But most people won't do anything and they'll just deal and suffer with it because they're afraid. Or if they're not just because they're afraid, is they're not educated about it because their doctor don't know about it. Their mom didn't do it, so she didn't tell them about it.
Hmm.
So they're just
Hmm.
not educated about it. So I tell everyone just to look and talk to your healthcare provider about your different options, what you can do, because there are natural things that you can do too. There are
Hmm.
some supplements and things that you can take, herbs and things that you can take as well that are natural. But I would say that if you want to look at HRT or if you want to look at the natural way, just look and talk to your doctor about what's best for your history of your medical history. I think is
Yeah.
what's
Yeah.
important.
But once again, it's diving into those things. It's not guessing.
Yes.
It's taking the time, get your blood work, whatever it is. I just
Yes.
did. I did this like 6 months ago, and it was fascinating to finally see like, well, no wonder I'm starting to
Yep.
feel so tired in the middle of the
Yep.
day and caffeine doesn't
Same
work
thing.
anymore,
Yep.
you
Same thing. Yeah. By the time I even found out with some of mine, I was already like pretty much almost into menopause when I found
Wow.
out. So I went through all this. I had already gone through perimenopause, and that's really what made me start to look into it. We learn about it in school, but it's not enough time spent on it. So really,
Yeah.
it's up to the healthcare professionals to take their own personal time to go and learn more about it. Hopefully, they'll start doing a little bit more in school. Hopefully, since I think there's a lot more talk about it.
Yeah.
But typically, you have to do your own research. And that's what happened to me when I started seeing that, oh, this possibly could be what it is. If I didn't know about it as a healthcare professional, there's no way that, other people who did not have this
Absolutely.
background knew
Yeah.
about it as well.
Yeah.
Yeah.
And I want to clarify when I joke about like, that's for people who are old. We're living longer. We're
Well,
not
we
old.
are.
We are like in
Well,
the middle of
but
our lives and we're going through this.
we
Yeah.
are. But I think that people have, they've made it to where On the commercials and everything. Like they don't look like us, right? They look older
Yeah.
than us. And those people probably are in menopause, but they forget about the people who are in perimenopause that look like you
Yeah.
and I
Yeah.
that are going through it. So we don't think it's us because we see someone chasing their grandchild around, you know. So
Right.
that's what we see on the commercials. We don't
Yeah.
see people that look like us. And I
And yet
think
you
the
look at
face of
people,
menopause needs to change.
I think so too. And you look at people who have little kids or like you, like
Mm-hmm.
preteen teenagers,
Mm-hmm.
and that's the middle of life. We're
Mm-hmm.
waiting,
Mm-hmm.
so many people waiting longer to have kids. They're going to go through
Yep.
all of this at once. But again, we're living
Yep.
longer as a
Yep.
as a
Yep.
society.
It is.
Um,
And I think, the average age of menopause is actually between 49 and 51. So
wow.
menopause is 49 and 51. And people say, well,
Wow.
I'm 55. Well, that's why it's called an average. So between
Yeah.
49 and 51, that's just the average of people that typically, when they typically have it. So we think so much older, but it's really not. It's really almost, almost there. And people really need to recognize those signs and symptoms as well
And the more
and
we
continue to go
talk
to the doctor.
about it and we understand and we don't feel an embarrassment about it or anything, it's
Hmm.
life. And we should be
Right.
able to have these conversations that are comfortable and
Hmm.
learn from each other.
Right, right,
Yeah.
exactly, exactly.
Yeah.
But I do want to, when I was talking about how much you go to the doctor and the things that you need to do, one thing that I can't be remiss, I know that time is so valuable and time is a
Hmm.
lot of times people won't go to the doctor because of their time, right? Because they're so, pressed
We're
and
too
stressed on
busy.
time. Exactly. We're so busy. But for you to set up your annual appointments and just have everything done at that time, whether
Hmm.
it's getting your mammogram or your or whatever you need to get done during that time, your blood work, your vaccines, those types of things. It's important just to have that set, schedule just for you, and
Yeah.
especially with keeping up with your vaccine, as I mentioned, earlier with
Yeah.
Hep B and Hepatitis B. Is really simple as far as when you are going to the doctor. It's only a 2-shot protocol, which means you can go, have a shot, and then you come back, in a month or so, and you get your next shot. So a lot of people think, well, I don't have time to go, but you really have to be able to keep up. And as far as people want to know about side effects, a lot of times it's just like when you have any other shot or a site injection, you may see a little irritation there. You could possibly have a headache or fever, just like with any other vaccine. So if people want to know more about hepatitis B, they can go to hepbcatchup.com because we need to catch up with our
Mm.
kids because they're so already ahead of us. So we have to take care of
Yeah.
ourselves as well too.
Yeah. Okay. So for more information, people to follow you and all that you're doing, where can we tell them to go?
You can, if you want to follow more about me, or learn more about me. I'm more on all social media platforms as Dr. Stephanie Yomo, and that's Dr. Stephanie Yomo, Yomo. Or you can go to my website, drstephanieyomo.com is where you can find me. And for
Great.
more information on Hep B, it is hepbcatchup.com.
All right, Dr. Stephanie, thanks for your time today.
No
Really good to
problem.
talk to you. The best to you and your family. And
Same
we just
here.
appreciate you educating us and helping us understand this topic for women.
No problem. Thank you so much for having me.